Good morning, my people. We are back again with our discussion about biopsies, all types of biopsies. We discussed about the first three types, which was bone marrow biopsy, endoscopic biopsies, fine needle biopsies, and today we'll be tackling the fourth type of biopsy, which is skin biopsy. And before I continue, it's always my pleasure to appreciate you guys for the fact you have taken me, because if it were not for you, this channel could not be where it is at the moment. I always appreciate the returning subscribers and each one of you who is doing anything, however little it is, to push this channel up ahead. Feel appreciated. And for those who have given their topics and have not yet been discussed, just be patient with me, and in due time we'll discuss your topic. Let's get back to our subtopic about types of biopsies. And we are discussing the fourth type, which is skin biopsy. And as the name states, it means the sample will be taken from the skin. So skin biopsy. If you have a rash or lesion on your skin which is suspicious for a certain condition and does not respond to therapy prescribed by your doctor, or the cause is unknown, your doctor may perform or order a biopsy of the involved area of skin. Let me repeat this one, it's very important. In skin biopsy, if you have a rash or a lesion on your skin which is suspicious for a certain condition and does not respond to therapy prescribed by your doctor, or the cause is unknown, your doctor may perform or order a biopsy of the involved area of skin. This is in order to test whether the area has cancer or not. Remember, we said that biopsies are mostly used to identify cancerous cells and the types of cancer. So, if you have a rash or lesion on your skin which is suspicious for a certain condition and does not respond to therapy prescribed by your doctor, or the cause is unknown, your doctor may perform or order for a biopsy. I hope we are together. So, the doctor will always perform or order a biopsy of the involved area of skin. The only area that is involved is where the biopsy is taken, not from the whole body. This can be done using local anesthesia and removing a small piece of the area with a razor blade, scalpel, or a small circular blade called a punch. This procedure can be done using a local anesthesia to numb the area first, and removing a small piece of the area with a razor blade, a scalpel, or a small circular blade called a punch. After removal, the specimen will be sent to the lab to look for evidence of conditions such as infection, cancer, and inflammation of the skin structures or blood vessels. After removal, the specimen refers to the area or the piece that has been cut from the affected area. That is what we call a specimen. So after removal, the specimen will be sent to the laboratory to look for evidence of conditions such as infection, cancer, and inflammation of the skin structures or blood vessels. I hope we are together up to that point. Next type of biopsy is what we call surgical biopsy. Surgical biopsy. Sometimes patient may have an area of concern that cannot be safely or effectively reached using the methods described above, or the methods we have discussed above, or the results of other biopsy specimens have been negative. Maybe the other biopsies have been done and they have been negative or inconclusive in making the doctor understand what kind of an infection or cancer or a condition you are having. Then this calls for a surgical biopsy. So, in surgical biopsy, sometimes patient may have an area of concern that cannot be safely or effectively reached using the methods described above, or the results of the other biopsy specimens have been negative. An example would be a tumor in the abdomen near the aorta. An example would be a tumor in the abdomen near the aorta. In this case, a surgeon may need to get a specimen using a laparoscope by making a traditional incision. Let me repeat again. Surgical biopsy. Sometimes patient may have an area of concern that cannot be safely or effectively reached using the other methods we have discussed above, or the results of the other biopsy specimens have been negative. An example would be a tumor in the abdomen near the aorta. Remember, the aorta is one of the main blood supplying components in the heart or in the body. So an example would be a tumor in the abdomen near the aorta. In this case, a surgeon may need to get a specimen using a laparoscope by making a traditional incision. Let's look at the risks of biopsy. The risks of biopsy. What risk are you putting yourself before you do a biopsy? Any, and get this very clearly, in risks of biopsy. Or what risk can you encounter when doing a biopsy, or when biopsy is done on you as the client? Any medical procedure that involves breaking the skin carries the risk of infection or bleeding. Get this very clearly, that any medical procedure that involves breaking the skin carries the risk of infection or bleeding. Any medical procedure that involves breaking the skin carries the risk of infection or bleeding. However, as the incision is small, especially in needle biopsies, the risk is much lower. Any medical procedure that involves breaking the skin carries the risk of infection or bleeding. However, as the incision is small, especially in needle biopsies, the risk is much lower. This marks the end of our video today. Thank you for your participation. Thank you for your time, and let's continue subscribing. And after you subscribe, don't forget to put the notification bell on, so that whenever I produce a video like this, or whenever I upload a video like this, YouTube will automatically notify you, and you'll never lose, or you'll never miss any of our educational bangers. Let's have a lovely day.